Hi, I'm Dr. Scott Laborowit, and I want to talk about the Ascend technology on the LenSx Femtosecond laser. This is really a how-to video for the horizontal lens cut, so let's take a detailed look at some ways we can leverage this technology. This updated pattern has a horizontal cut in the nucleus, and it could be at the 50 or 80% depth. This is showing the screen where you can adjust the depth percentage from 50 to 80% and then accept it for each case. And then you can also see how far you want the horizontal cut to overlap in microns. You could program 22 microns where it would overlap, or you could put in negative 22 microns where it won't get to the outer cylinder. So this is the femtosecond doing the typical capsulotomy, starting from the bottom of the nucleus, working its way up, and then there's a horizontal cut, in this case at the 60% area. This is showing another example. There's a big air bubble you see, and then the horizontal cut at 60% of the cut nucleus. Here we can see the graphic interface shows the horizontal cut, in this case at 50%. So how can we leverage this technology? If we have an area where we can remove a plug bolt out at 4.8 millimeters, the peripheral would be small enough to have the quadrants fit in that bolt out area. Even if you can only bolt a 4.2 because of a smaller pupil, you can still fit, in this case, a 3.4 millimeter quadrant, and therefore you're working in a new workspace you created and not near the cornea or the iris plane. Here's the femtosecond again showing the laser, and then there's a horizontal cut, and then it continues to make the remaining cylinders. A lot of times surgeons will do the surgery with the laser and make the pattern that they want, but then they kind of walk somehow between the laser and the OR, and they completely forget that they did the laser. And so they'll use the same phacoemulsification settings on their machine. They'll sit down and do pretty much the same surgery and use pieces of the technology of the laser, but not really fully leveraging the potential. The imaging does allow precise, predictable laser cuts. The capsulotomy is adjustable, but you have these pieces now that I call bowling the lens out, which I would never do in a typical case. However, here the laser can be leveraged to crack and chop and remove pieces, and then everything's a known size. So let's look at this surgically. So here we are with a patient that has a 4.7 cylinder pattern and a horizontal cut that extends beyond the last cylinder by 22 millimeters. And then we also have at 60% depth of the cut nucleus. So you'll pay close attention to my phaco tip and notice it never truly leaves the central area of the nucleus, so it doesn't go beyond the capsulotomy. And I'm using my second instrument to just flick pieces up of the laser cut nucleus. It's also nice because I can see where the horizontal cut is, so now I'm using my tool to just go along that horizontal cut, and I have good visualization, and I'm able to lift up the fragmented pieces. So the phaco tip, again, is acting as a trash can as we deliver and try to bowl out this area. I'm being careful also not to put too much pressure on the zonules. You'll notice I did not hydrodissect. I also did not rotate this lens at all at this point. And I'm using now my phaco tip as a third instrument because the second instrument is now my first instrument, but that's how I'm now cracking, because the chop pattern goes to 5.3, so it extends beyond the bowled out area. I'm more confident placing my second instrument here now to remove the bottom 40%, because I now know that the horizontal cut's at 60%, so that acts as a depth gauge to allow me to place my instrument strategically and carefully to not go through the posterior capsule, but be able to lift up the remaining pieces. Now the quadrants will be able to easily come into this bowled out area because the chop pattern goes to 5.3. I could put my instrument in and visualize it using my phaco tip as a third instrument in this case. And then I also can place that second instrument into that cracked area, again, knowing the size of this quadrant because it's all been cut by laser and known sizes. You can also see once I remove this quadrant that the laser was playing a role in this creation of the quadrant, because you can see the edges of the removed area are very straight, unlike when you crack with, let's say, a sculpted out groove. I then can easily rotate the second piece into where the first piece was to more easily grab and move into the center. Notice I'm working within the bowled out area within the bag, further away from the cornea, and there's been very low CDE at this point as well. Here's another case. The cases do tend to look similar because you're pretty much doing the same thing each case, because it becomes very predictable because the laser is creating all these shapes and pieces consistently off of imaging. So here I'm just using my second instrument. The pieces are a little more easily coming up to the phaco tip here. And sometimes I'll even crack a little earlier to help get my piece in to lift it up. I have a lot of confidence as I go under these pieces because I know the horizontal cut's at 60%. So again, there's a measuring stick having that laser cut, and it'll guide me with my second instrument. Again, pay close attention that the phaco tip's not unsafe at any point during the case, because it's never angling down and it's not reaching beyond the 5mm capsulotomy. Once I remove the central plug, I'm then cracking and then bringing that second instrument in to then pull the piece to me. Having known sizes of quadrants and plug sizes makes every case very consistent, and you gain more and more confidence with your second instrument, who really becomes the star of the show. So let's use a cartoon to show a little thought experiment. And this is a coronal section. That's the 5mm capsulotomy. I'm at 4.7 for my cylinders, and this is showing a 50% depth. And then once I remove that at the horizontal cut, I then have 50% depth left. And that's why I was saying I have a depth gauge while I'm operating. Keep in mind the uncut nucleus is a 500 micron cushion. So as long as you're working and still see laser cuts, you do know you have a cushion there. And then my chop pattern goes to 5.3. That's why once I bowl it out or remove that plug, I can still crack it because the chop goes beyond. Here's a bird's eye view of the same laser cuts, a 5mm capsulotomy. The plug is 4.7 millimeters. That's 48 pieces the laser's cutting that area into. And then chop goes to 5.3. We can also see that since I have the horizontal cut overlapping by 22 microns, that it actually allows gas bubbles to collect outside of the plug area. And I watch for this so I can then stick a second instrument in those gas areas to allow leverage. Here's a nucleus that I was able to bisect and take a picture of. You can see the horizontal cut nicely here. And what's happening is you no longer have these long pieces of nucleus. We now bisected it, so I say it's like we went from French fries to tater tots. But it's much easier to remove these pieces because they're cut in half, so the surface tension isn't as much. This is showing a 70-30 cut, and then there's the 500 micron uncut cushion between the posterior capsule and the laser cut in the deep area of the lens. This is showing I'm sticking a hydrodissection into the horizontal cut, and sometimes in soft lenses I do this where I'll hydrodissect the superior 60% of the cut pieces just to float them up and remove them. Just one more time, now that I've shown you many examples and the strategy on my chalk talk with the cartoon, you can now see and think differently. As I use the second instrument, these 24 pieces above the horizontal cut can more easily come up because they're like tater tots instead of long French fries. I'm working at 4.7 core area to remove what I call the plug. I do like the 60% depth. I think it allows for good visualization while I'm working, and it gets most of the densest part of the cataract out easily. Sometimes I'll even crack before I removed all the pieces. It just helps me get pieces to crumble up from the core into my phaco tip. Again, with confidence, I'm aggressive with my second instrument because I know what 60% depth looks like. So now I can easily go deeper knowing the different depths. So once I remove this plug area, you can see sometimes I'll crack even the plug with the phaco tip. And then in this case, I didn't remove all the plug, but it was enough to get this quadrant out. And the phaco tip is acting like a third instrument, but when it's actually being used, it's flat, not angled down, and in the middle in a safe area. Again, here's evidence that the laser's doing the work, because you can see these quadrants are laser cut, known sizes, with straight lines on the edges. You can see in this very dense lens, the CD is under 2.5 at this point. Anyway, thank you for taking time to learn this new technique and leveraging the new Ascend technology in femtosecond laser cataract surgery. Thank you.